Sure.
So this is Dr. Lamb. We're going to do a block, a PT block, a PT ankle block, just to numb up the nerve to the bottom of the foot. We're preparing for the radiofrequency ablation for the bottom of the foot, the neuroma right here. So how does the neuroma look and feel like? Well, let's see, feel. A little click right here. I squeeze. Third inner space is most common. It pops. The patient can confirm the pop.
Oh yeah.
Correct. So here's what we're going to do. In order to not interfere with the radiofrequency ablation, I numb up the nerve above the ankle right here. This nerve is the tarsal tunnel. It goes all the way down into the foot. Now, when you do this, when we have to do surgery on the bottom of the foot or any procedure on the bottom of the foot, or even for tarsal tunnel syndrome. So this nerve, believe it or not, goes all the way to the bottom, and we'll see the bottom of the foot turn red when we get the block going, and you'll be totally numb on the bottom. So here we go. We're gonna do this live on the ultrasound and go from there. Gotta give a little bit of a prep. For the students, for the podiatric medical students or anesthesia students out there, we are looking at I'm scanning the, hold the nerve, hold the knee please, hold.
Do what?
Yeah, just like that.
So basically I'm having her knee held. Sometimes patients have this kind of jerk reaction that is not just a reflex reaction when we hit the PT nerve with the needle. So here we're gonna go ahead, we're gonna look at that screen right now, okay? I have my probe right on the medial side of the ankle. I prepped the skin already. Now you see that is the nerve right here that I'm looking at. I'm putting it right into the middle of my probe. Julie, my assistant, is going to go spray right in the middle. And we're going to go ahead and you could bounce between the two screens slowly. Between the screen and the patient, you could bounce between two. Now you can see the needle, the medication going into around the nerve. I'm a little bit anterior, so I'm going to redirect the needle posteriorly. Right here, I'm right at the nerve. Do you feel that? Do you feel that, Miss Patient? Mm-hmm. It's going into your toes? Or your big toe, at least?
No, not yet.
See the fascicle of the nerve separating right there?
Oh, I felt it hit something.
Yeah, right?
Mm-hmm.
Again, this is PT block, very accurate PT block. And, you know, we're always taught in school to block, I'm going to go posterior, to block around the medial ankle. Right, you feel that? Mm-hmm. I'm right in the fascicle of the PT nerve now, one of the branches of the PT nerve. You can see. Feel that going in?
Yeah.
So I'm in the fascicle of the PT nerve. You see the medication going in, expanding that. So now you can see the medicine within the PT nerve. We're going up and down. You're doing all right? Beautiful. The two branches right there. We see the PT nerve, the two branches. We're going to go more proximally. Are you okay? Mm-hmm. Any pain, tingling?
No.
Nausea?
No.
Good. Funny taste in the mouth?
No.
Okay. The reason why I asked about that is, you know, if any of the local went into a vein, etc., which can happen, very rare, but you can have metallic taste in the mouth, which is for the students here. That is one of the complications of getting a local in there. But again, I'm looking proximally to where I injected. I'm going distal to where I injected. I see all this fluid right around the PT nerve right here. So I'm pretty confident the PT nerve is blocked. You're going to see some hyperemia if you look at the foot right now. If you look at the foot right now, the hyperemia is going to start to kick in very soon. We're going to come back very shortly. The foot is going to turn beet right on the bottom. So we're good with that. Now, since we're talking about neuromas here in this video, we're going to take a look at this neuroma. Take a sneak peek now. The hard block is done. We're going to go onto the bottom. Let me get more gel, please. Okay, right here. We're going to take a look at the neuroma right now. I'm scanning the bottom. This is the... Are you doing okay? Am I hurting you?
No.
Okay, good. Sorry. Right here, I am pushing down. Now look at the ultrasound screen again one more time. So I'm going to go ahead. I'm going to decrease the depth, so get more concentration. Now this is the third piggy, this is the fourth piggy, this is the third piggy, fourth piggy. Okay, the nerve is in between these two. Right there. that enhancing that enhancement is the neuroma right there. We see that on the screen. Now we're gonna. I'm squeezing the metatarsals. You can see that nerve is pretty solid in there. Pretty nice size, solid neuroma right there. Even better. You see that. That's where we're gonna stick our probe it right into that nerve, and we're gonna go ahead and pretty much burn it. Again, I'm gonna squeeze it a few times. You can see that nerve in the third interspace right there. So we're going to pause it now, and then we'll come back when we're doing the radiofrequency ablation. Alright, here we go, radiofrequency ablation. She's numbed up already, we're ready to go. Do you feel my fingernail? She does not, the block worked, beautiful. So I'm going to go ahead, we are going to be in the third interspace. I can still feel it click very well in there. Okay, so the block is done. We're gonna go right now. This is the size of a normal needle, actually. There's nothing special. It's a trocar. Any pain? Any pain?
I'm fine. I'm fine. I just when you talk needles. No, no pain.
Okay.
Guess I should listen.
Yes, you should. He's asking you a question.
So I put it right into the third interspace neuroma right now. I can pump it. I can feel it. Now we're right in it, right in the mid substance. Go ahead. We're gonna put the probe right in there. Okay, I'm gonna confirm it one more time before we start. Okay, it's no longer popping because this is right into the lesion itself. Pretty big lesion. We're gonna go ahead. 90. Temperature is going to go up to 90 degrees Celsius. Once it hits 90 degrees Celsius, we're going to start the timer. Slowly heating up. We are talking about Celsius here. So 1, 2, 3. Hold on, hold on, hold on. And now, go. This is the timer. Welcome back from vacation. So here we go. Do you feel anything?
Not a thing.
Well, it's 90 degrees Celsius in there right now. It's burning the nerve.
Celsius.
90 degrees Celsius. And
It's pretty warm.
the numbing medicine worked.
Fahrenheit, Celsius. 168?
It's
160?
it's almost 200.
Almost 200.
Yeah, it's like 190, 92 if I'm not mistaken.
Going good, going good. Leisure time, 90 seconds. Temperature's at 90. We don't need the stimulator. We're doing RF ablation. Very simple. Okay. Off.
I can't see.
Off.
The thing is still.
Okay, I just repositioned it into hit the bulb of the neuroma right now. Before I was at the stalk back here, and then it's gonna fan out. It's gonna be a big bulb right here, and it's gonna split again. So I'm right at the bulb of the neuroma, the thickest part of the neuroma right now. Temperature back up. Going back to 90, and we're gonna go ahead. Perfect. See, you don't feel a thing, right? So that nerve block worked.
Yes, it did.
It's magical how that works, right? Just wait for the countdown. And then what I'll do, I'll reposition the last one. I'll reposition needle, just go a little bit further into the bulb, and burn it one more time. So 3 shrinking positions in there will help to shrink that nerve. Where did you travel from? Are you local here?
Kansas City. Lisa, yeah, Kansas City.
Kansas
It's
City?
very cold.
This
cold here, but
this is our cold front right now.
Yeah, it was -8 the other day.
Oh boy, good news you're here. We get a lot of patients who travel from all over the United States to get this treatment done, so it works really well. One more time.
Give me a moment, please.
Beautiful. Last one. Go for it.
Okay.
And then about 1 month, we'll come back and we'll do it again.
Okay. Will there be swelling?
Minor.
Minor.
Pain-wise, nothing, a little Tylenol, Motrin can't handle.
Okay.
Get some ice on it. And
When?
as soon as you can.
As soon as I can? Okay. You're making chili.
Well, just go back to Kansas, put your foot outside.
Yeah. No, thank you.
Definitely freeze then.
Might shrink your neuroma too.
Yeah.
Yeah, this is the radiofrequency, very simple, very efficient. We could, you can feel the neuroma, we'll go right for it. And the other one, we saw the neuroma, we saw the nerve right here on the side going down. So that's how we get the block effective, efficient. It wasn't too bad, right? The block?
No,
Yeah.
it wasn't.
So in 4 weeks, it's the exact same?
Same exact process, yes.
Okay. 3
So-
times, boom, boom, boom.
Boom, 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 yes.
Okay.
So make sure we get an appointment for 4 weeks from now, and make sure we give it like a surgery time slot, not just an established patient time slot. Okay. Okay, good. Here we go. I'm taking this out and putting the alcohol. This is the alcohol sclerosing 4% alcohol solution right here. Go ahead and put it right into that nerve now. With the same goal of neurolysis or damaging the neuroma itself. Gonna hit that area. Hit that nerve. Done. That is it. Voila.
Okay.
Radio frequency number 1 done. Not too bad, right? I didn't feel
No.
a thing. You did wonderful. Okay.
No.